Just as the coronavirus outbreak appears to be stabilizing in China, each day's news cycle brings stories of new nations and new types of patients impacted. Islam's holiest site, Mecca, shut to pilgrims. Japan, which has ordered all schools closed till the end of spring vacation in early April. They're now wondering whether to stage next summer's Tokyo Olympics. Here in France, health authorities scrambling to figure out how victims who had no contact with the most infected area came down with COVID-19. 2 months after the detection of the first cases, is it still too early to draw conclusions? How solid is the science? Just how much is the world coming together? As worries grow and stock markets tumble, the French president happens to be in Naples for a long-scheduled summit. With the north of Italy reeling from this continent's worst outbreak, what precautions, what help for a nation whose industrial heartland and tourist trade could be crippled? How much of a test for Europe and for the world? At a time when go-it-alone nationalism is on the rise, can humanity come together with coordinated, credible crisis management and effective collaboration to face what may or may not be an already out-of-control pandemic? Today in the France 24 debate, how to counter a potential pandemic. Joining us, Dr. Jean-Jacques Zambrowski, professor of public health management at Paris's University of Descartes. How are you?
I'm fine, thank you.
I want to welcome as well. She's been on the front lines of the Ebola outbreak in Congo. Dr. Sashvin Singh is with Doctors Without Borders, Médecins Sans Frontières. Thank you for being with us. Matteo Ghisalberti, editor-in-chief of Puig Media.
Good evening, thank you.
Puig Media, which is?
It's an independent media, French-based.
All right, thank you for being with us. Jan-Cedric Hansen, Secretary General of the Global Health Security Alliance, joins us from the Normandy capital of Rouen. Thank you for joining us.
Good evening.
The France 24 debate on Facebook and Twitter, hashtag F24debate. Let's start in Geneva, the head of the World Health Organization, coming closer still to labeling it a pandemic. He's still holding back, though, for now.
Our message continues to be that this virus has pandemic potential. Once again, this is not a time for fear. This is a time for taking action now to prevent infections and save lives now.
Dr. Zambrowski, there's a bit of a mixed message there. He's talking about pandemic potential, and then he's saying, don't be afraid. It's not a time for fear.
Potential doesn't mean at all that there is a pandemic going on.
Okay, so define for our viewers what a pandemic is.
It might be, but it might well not be. Nobody knows for the moment. And there is a kind of uncertainty there, whether it will turn into what is called a pandemic or whether it will remain a new type of virus having an ordinary epidemics.
Is it a semantic nuance or an important distinction whether or not it's a pandemic?
It's rather like a kind of a nuance. Although the precautions and the size and the number of people involved and the capability of the health authorities and the health power everywhere might not be involved the same way. The more there are millions of people suspected of having the virus with them, the more it will be difficult to control that. So it can be a pandemic. The name itself means everybody, while an epidemic is dozens of people, hundreds of people. Actually, the flu in France is 10,000 people at least who go to the hospital for that reason in France annually, and nobody cares. So it's more than a purely question of vocabulary, a question of level of risk.
Although, and I'll put it to you, Dr. Jan-Cedric Hansen, what we're asking is it out of control already?
No.
No, it doesn't seem to be out of control. It's spreading. It's a natural thing for a virus to spread over a population. And it is using the way that it finds through the population movement and things like that. It would be out of control if our hospitals everywhere would be overcrowded by patients looking for treatment and with large amount of people with lung disease and respiratory distresses. And it is not the case right now. So it is not out of control. And what we need is to have every citizen to be concerned about how to protect himself and the others. And this is the barrier measures. Wash your hands, wear a mask, avoid to be in crowded places. This would help to stop the spread of that disease.
And also, one of the things that's been talked about is thinking twice before going to the emergency room.
Of course.
Yes, think twice, because right now the best treatment is the flu treatment and home care. The best treatment, if you are touched by that virus, is to take aspirin or acetaminophen, or very basic drugs that you can have without prescription, to decrease the fever and to decrease the sore. So basically, most of the people might even be contaminated or infected without notice, because it seems that most of the cases are actually asymptomatic, which means there's no symptoms, not even fever, or maybe some shivering, and that's it. So the part of the mild side of the disease is certainly broader than we can perceive it right now. We are focusing on people with symptoms and the people with severe, and they are our concern right now, with respiratory distress. Those are our concern. The others, that's okay.
The others, it's okay.
Yeah, well, I think there's a few things there that I'll just interject with. So I think first of all, I agree with some of Dr. Hansen's comments that that it's not out of control, that it's a natural phenomenon of a virus to be spreading, and certainly that's what we have seen. Of course, it is a concern that there is a new virus that is still being studied and is causing some significant morbidity in some places. However, it is important to remember, like Dr. Hansen said, that there are a lot of cases that have minimal symptoms or that have very mild symptoms. In fact, the data suggests that it's about 80% of cases that are reported and diagnosed are mild, and there are probably others that are still milder than that. But I don't agree with the advice to that everyone should wear a mask. There's actually no evidence that wearing a mask in the community is helpful, and I think giving that message is probably just going to spread more fear and panic. Obviously, for healthcare workers that are in contact with patients and in close proximity where there is, coughing and respiratory droplets, then it is useful. But there's after a lot of systematic reviews, there's no evidence that people just in the community should be wearing a mask.
Dr. Zambrowski?
I just wanted to insist on your question about going to the emergency room, because if you are infested with this COVID-19, which is the actual name of this virus, and if you start splitting and shaking the hands of everybody or just being close to those people, then you will have more people infested. So the good thing is in countries like France, for example, who said, call an emergency special call center, and they will tell you where to go, whom to see, and how to manage. Because the worst thing, if you do have an infection with this virus, is to go anywhere and spread it all over. So in some countries, you have no other possibility to see a doctor.
Do you agree with Dr. Singh that
I
wearing a mask can
in most of the cases, because most of the masks are useless. I mean, it can prevent you from receiving a split from somebody else, but it doesn't. If you are having the virus, it will not prevent the others from catching it from you. And this is probably what happened to those people whom you don't know what was the source of the virus. Those people in the surroundings of Paris, probably, they met someone who it's the story of a man who met the man who met the man who saw the bear.
Right.
Nobody knows.
We'll talk more about that in a moment. We heard at the outset the head of the WHO saying it's not a time for fear. Fear is certainly something that's contagious. It also sells newspapers. The Daily Mail reporting how the Pope canceled an event in Rome due to what the Vatican calls a slight illness, this one day after he was seen blowing his nose and coughing during Ash Wednesday celebrations. However, it's obviously not that serious, since the spokesman said that Francis would continue with the rest of his day's business. Matteo Ghisalberti, I'll turn to the only other layman on this panel besides me. You go through the day oscillating between being reassured and being really worried.
Well, actually, if I consider what my country is doing, so Italy, I'm very worried because Italy, unfortunately, showed how you don't have to do with a crisis like this. Because we saw that the first period when we got the first news from China, the government stops the flights to and from China, and then when China protested because they considered that these measures was too strong. Well, the government said, okay, we don't need to do any quarantine, and if you want, if you feel sick, please stay at home. But it was left to the volunteer of the people. So. Everybody was authorized to go everywhere, and when I heard the prime minister saying that the hospital in Codogno, which is one of the epicenter of the epidemic, saying that it was their behavior which was wrong because they contaminated a lot of people. Yes, I said okay, but at the same time, the government says everybody is free to do what he wants because it's not so big mistake and a big heel to if you catch this sick.
I think just to step in there. So yeah, some of what you say I think is quite valid. That there was a bit of potential misinformation through like media sources, and that differs from what people are told like from government sources. However, I think we have to stick with what we know with this virus is that there is potential transmission before people have significant symptoms. So they might have very mild symptoms or even during an incubation period.
Actually,
so I think it's important to remember that closing borders and making really restrictive travel restrictions, it's not really going to change practice. I think the virus is out there, and I think we
why? Because it's too late. In other words, is what you're saying?
No. What I'm saying is that this happens with many different illnesses. It happens with influenza, viruses that they spread, and we shouldn't be in this strict sort of containment mode because what we're seeing now is that these really strict border policies and it's really affecting it has a lot of flow-on effects, and we in MSF are a little bit concerned that this is going to have quite significant impacts on things like essential surgery. Places where we work, like in Yemen and in the DRC, they already struggle. Our Ministry of Health colleagues struggle to deliver essential surgeries and care. Already without a COVID context, and the fact that now a global supply of masks and essential surgical items and drug production could be affected because of these strict importation and border closures and then the socio-economic effects that it has on populations and people's livelihoods actually could be quite a lot more significant than.
Let me bring in Jan Cedric Hansen. You agree that the minuses outweigh the positives when it comes to travel bans?
Oh, yes, definitely. Banning the travel is not a solution. The virus will spread anyway. So it's the point is we should not consider catching that virus as a magic thing. We should consider that when we catch the virus, it's because there is a load of viral particles in our close environment that is sufficiently high to trigger the disease inside our body. So when you cross someone for a few seconds in the street, there's no fear. Even if that person shreds some virus particles, it very, very little chances that you catch the disease.
So let me ask you on that point, Dr. Hansen, was Lyon right to host Juventus in the Champions League Wednesday?
Well, as I mentioned on the French side of France 24, it was not wise to have all those people traveling by buses, because during the travel by buses, you increase the chances that some of them get infected. But while they were in watching the match in the place, it's open. There is lots of wind. The virus is diluted. The virus particles are diluted. So it's not that dangerous to be in a crowd where you have lots of air and the air is renewed. So the important there's no black and white answers or yes or no. It's very subtle. So it's not wise to travel in packed environment, but it's not wise to prevent people from traveling. That's the point, because the virus will go everywhere, no matter. We have to learn to live with that virus and to protect ourselves individually. I just want to make a specific comment to Dr. Singh. When I was mentioning wearing a mask, I was talking about the patients to protect the others.
Absolutely.
And of course,
That's what I
only
wanted to
the
stress.
health professionals need to wear the mask, and it's different kind of.
Thank you. Yeah.
That's something very important.
Briefly,
Not everybody should wear masks in the streets. That's for sure.
Matteo Ghisalberti, just briefly.
Yes, unfortunately, yes, I agree with the doctors, but I'm not a doctor. The point is that I saw in Italy very, very bad decisions because, yes, that's true that we can't stop, we can close the borders, but we can check the people or we can inform them. For example, we said some minutes ago that it is important not to go to the emergency rooms. Well, in Italy, we went, a lot of people went there because we didn't understand what to do after the changing of the decision of the government. And then, so I think that it would be better before to check and say to the people, yes, please do this behavior, have these behaviors. And instead of let them go everywhere and let them decide what to do. I think that in this moment in Italy, we have a lot of self-made solutions to protect themselves.
There isn't a holistic policy, is what you're saying. We're going to pick up on this point when we come back. How far do you go in trying to contain the disease? You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and we're sorting fact from fiction when it comes to the coronavirus outbreak. Doing so as it, on its 50th day, seems to be stabilizing in China, but spreading elsewhere around the globe. With Dr. Jean-Jacques Zambrowski, who teaches at Paris's Descartes University. Welcome back as well to Dr. Sashvin Singh with the epidemics team of MSF France, that's Doctors Without Borders. Joining us as well, Matteo Ghisalberti, editor-in-chief of Puch Media, and from Rouen, France, Jan-Cedric Hansen, who is Secretary General of the Global Health Security Alliance. Yeah, from next Monday till the end of spring break at the start of April, Japan announcing it will be shutting all schools.
There are many efforts being taken to stop the spread of infections among children in various regions, and the next couple of weeks will be an extremely important period.
So shutting schools, Dr. Zambrowski.
Well, we said that in France, in some schools, parents should not bring their children to school if they can. In some of the schools, do this. But all this is politics. All this is precautions.
Which is it? Is it precautions or politics?
It's both. It's a political precaution, if I may say so, because there is no scientific evidence, and for the moment there is no children who died from the disease, even in China. But it's uncertain, and until we know, the last people with whom we would like to take any kind of risk are probably children. So, most of the deaths, if not all of them, apart from this 60-year-old man who died in France, were old people with a lot of what we call comorbidities, which is other disease from chest or from the heart or from diabetes and so on. So normally a sound child or a sound adult has a very little risk, and the symptoms it will have will be those of an ordinary flu. I mean, it's important to remember that all these, like closing the borders and so on, are what I call political precautions. But what would be the reproach to the politicians or the legislators if they would not do that, and if anything happened. As we said at the beginning of the conversation, we don't know if it will be a pandemic or nothing but a new kind of virus with an ordinary epidemics.
But you've heard there Matteo Ghisalberti criticizing Italy's government for crisis management that's clumsy, is that if I'm characterizing. So what do you do if you're a neighboring state and you're faced with a country that is sending mixed messages to its own citizens?
We're not going to close the border with Italy. Mm-hmm. We're not going to close the border with Spain, with Germany, with Belgium, with Luxembourg. We work together. We have a lot of exchanges all day long. And I think the policies over there are reasonable. And now the Italian policy seems to be more reasonable than on the very first hours. They probably were wrong in the very first hospital. They probably did not warn enough, took enough precautions. But nowadays they do. And the meeting the European ministers had together is precisely there to set a common EU policy. I don't know. I'm not meaning that in Middle East or in Africa, where the risk exists as well as here, or even in Japan, which is not that far from the core of the infection, the same policies would be any valid. Probably not.
Matteo Ghisalberti, of course, we've heard the far-right leader in Italy, Matteo Salvini, like the far-right leader here in France, talking about closing borders.
Yes, actually, the point is that there was a mix on political and precaution topics in Italy. And when Mr. Salvini said, please take care of the situation and decide some quarantine, well, the government said something very political. No, you are racist. No, we can't do these measures take these measures because it a way to be racist against Asian people or Chinese people, especially the communities who are living in near Florence, which are very, very big. But the point, it was not political. It was just a measure to save people and to make safety people. So I think that the problem is that the Italian government mixed with political problems, their political problems, with precaution.
Same in France. The right party, the Marine Le Pen's party, closed the borders, took the precautions. It's the principle of precaution, which has no medical sense. I mean, they can go into politics where they want. I mean, It's up to them, their opinion. But it has no scientific evidence at all.
All right. As you said earlier, it's early days yet for the data, Sashvin Singh. According to statistics I saw from the Reuters news agency, they think it's 3.4%
less
cases that are lethal.
Far less.
Yeah,
Perhaps less. We're not sure.
Yeah.
You've been working in Congo with Ebola, where the mortality rate is much higher. How does containment work when you have an outbreak like this?
I guess it's a good point that you've brought up about the we kind of have to keep things a little bit in context as well. So I mean, the Democratic Republic of Congo is in the still in the midst of an Ebola epidemic, and also in I think it's really important to mention that they're also in the biggest epidemic ever of measles, with significant morbidity, particularly in malnourished children, and so it's a huge epidemic. In places where we work, where we do have a lot of experience in being able to ramp up quickly in infection control measures. So, for example, from an MSF perspective, what we've been doing with our field teams is really encouraging going back to basics with the infection prevention and control procedures that we've already discussed about good hand washing, good cleaning of hospitals, and really things that should be done. They're not specific to coronavirus. We also put in place.
Does that message get through?
Yes, of course it does, yeah. So I think what we find actually is during, and this happened during SARS, and it happens during bigger influenza outbreaks, but all over the world, you encourage good what we call IPC, infection prevention and control measures, and then we sort of see a reduction in other illnesses like gastrointestinal illnesses because people are paying really good attention to simple things like hand washing. But yeah, we do we've provided some preparedness planning to our field. We've and ask our field teams to approach the local ministries of health to offer some support and some simple trainings to really help I won't use the word containment, because as we've discussed, then these viruses do spread quickly and we might not necessarily be able to contain them, but really to prevent illness, prevent the spread, particularly to sick people that are presenting to hospitals with other infections.
The closest disease in terms of symptoms is flu, ordinary flu, with a virus we've known for years. The mortality of the flu infection in our countries is 1 out of 1,000. The mortality of the COVID-19, the coronavirus, seems to be 1 out of 100, not 3.5. We are reducing the figures now to 1. So
As we
it's 10
screen
times
better.
more. 10 times more. Now, yet, the measures and the symptoms are just the same. And the people who died from the same kind of severe respiratory syndromes and so this malfunction. No, the question is, how do we control those people who have something that looks like a flu clinically and that have been infested, and how were they infested, and to scale up to what we call the zero case or the case zero, which is the origin, the source of the virus from the market in Wuhan, in China, to them, including in Italy. And the gentle reproach we can have to the people in this hospital in Italy where the patients came from China is, why didn't they just ring the bell when they admitted this patient coming back from this group of patients coming back from China and said they have a probability or a possibility and done the test. The test is available now everywhere in all of our countries. Again, I'm afraid I cannot discuss it of the capability of Yemen, you mentioned,
And what about, and I'll put this to Dr. Jan Cedric Hansen, what about all the talk of searching for a vaccine, because we don't have one yet? Does it, at this point in time, when you listen to Jean-Jacques Zambrowski, is it urgent, or is that not the biggest priority at this point?
Well, it's always interesting to work on different solutions, but right now, as you mentioned, the vaccine might come late. The natural history of epidemics is, to one point, it slows down, and maybe by the time the vaccine would come, the actual outbreak would dampen. But it would be interesting to have it for a next outbreak. So it's important to work on that. What is more important is to work on the symptomatic treatment, because that is what is the most important right now. How to control the lungs disease and how to control, because that coronavirus has a specific tropism. What means it likes to infect the heart of the people. And because it weakens your lungs and your heart, it kills you when it comes to frailty people, elderly, frailty elderlies. But if we can use against that virus, we may and we should try the antivirals that are already available, because we've made tremendous progress in killing or treating viral disease. And there is lots of armamentarium regarding this now with antiviral drugs. So maybe among them, there might be some good candidates as well.
Yeah, authorities in China are expressing hope in the use of, and you mentioned it, chloroquine, the anti-malarial treatment. Agreed, says French virologist Didier Raoult. His team at Marseille's Mediterranean Institute of Infectious Diseases has been touting the virtues of chloroquine for 10 years, he says.
There's a kind of excitement, a need to find new medicines. We have to find new vaccines. If you tell them, look, you can just take chloroquine. It's easy, it's not expensive. You don't want to take it. You're cutting the ground from under the feet from a whole host of people who think they're going to win the Nobel Medicine Prize for a new medicine or a new vaccine against coronavirus. When you look at the number of new vaccines that have been marketed the past 30 years, the chances of making a new vaccine that can be marketed is close to zero.
So here's the question, Sashvin Singh. Right now, the scramble for treatment, either a vaccine or palliative care or some kind of treatment for the disease. Is there this callous race to win prizes and make a lot of money going on?
I think that's a bit of a cynical view, and but no, I think with there are some really interesting things that came out of the West African epidemic of Ebola, for example. So and also from SARS. So having these big sudden epidemics that do cause a lot of distress also kind of brings in a lot of investment into health care and health sciences. And so what we do see is a rapid sort of progression of technologies and investment in researchers. So what I just wanted to say with the coronavirus is that there was already a mechanism in place where there's a group that's been around since 2017 to respond to new and emerging diseases.
And when you hear Dr. Raoud say, why are we looking for all this stuff when we've got chloroquine?
Yeah, I mean, I don't think we've got good evidence that works. There are some encouraging results on a few tests, and there are some clinical trials, more than a dozen clinical trials on the go in China at the moment. Looking at several different antiviral medications that could be promising. But I mean, I think the research into therapeutics and vaccines is really important. But I want to come back to the basics of preparedness and thinking about the bigger picture.
Thinking about the bigger picture, Jan Cedric Hansen.
Yeah, well, back to the chloroquine story. It's a very old product, a very interesting treatment. And it has anti-inflammatory and fever killer properties. So there is lots of confusion in the use of that product. Maybe it's just a side effect that it actually dampen the disease rather than cure the disease. So we should be very cautious, and the publications available are not exactly scientific articles. They are more, I do believe that, I have noticed that, but this is, we should be cautious on that claim about the chloroquine. What Dr. Singh just said, working on different kind of solution and options and see what works the best is more relevant. And again, prevention is more, it's more interesting to invest in prevention and mitigation of the disease rather than to cure it. Because as Dr. Zambrowski said, it's just like a flu. Even of the severe cases are more likely to die. The mild cases are just like a flu.
All right, before we go, because we're running short on time, we must talk about how it's spooking citizens and markets. The stock exchanges continue to tumble. Wall Street down 9% this week. The Paris exchange is into what investors call correction territory, more than 10%. Proof of how interconnected the world is. At the epicenter of the outbreak in Italy, the Lombardy town of Codogno, which is under lockdown. It's home to an electronics manufacturer that supplies Fiat, Renault, and German car makers. 60 of the factory's 600 employees have been allowed back in, thanks to a special dispensation. They'll be staying under quarantine while working to keep the plant running. Otherwise, it's assembly lines across the continent that might shut, they say. The French finance minister, he says the coronavirus is forcing a complete rethink of supply chains and how our economies run.
I really think that we have to take the situation of the epidemic to ask ourselves about our strategic dependence in terms of supply for certain industrial sectors. I've talked about the car industry. I also want to talk about the health industry. You know that 80% of raw materials for active components, for medicines, come from China or from Asia. It's obvious, and the epidemic shows it, that this could bring about problems on sanitary independence in the medium or long term. We have to respond to this challenge and this risk.
So, is that a valid point we're hearing from Bruno Le Maire? Or is this political flag waving, saying we got to make in Europe or make in France rather than in Asia or China?
Well, actually, I think that the situation with Italy is different from the relations, economical relations among China and France, because Italy, first of all, is close to France, and then we have a lot of industries which are strictly connected, not only financial one, because many Italian banks are controlled by French one, and so if the activities stops, French activity could have could tumble, and
that's why markets are dropping right now.
Yeah, but there are a lot of fields which are interconnected. For example, if you consider foods, for example, luxury, but also furnitures, which are produced in Italy and sold in France. Well, there's a lot of things that could be affected in the next weeks.
So what do you think? The finance minister is saying we have to have shorter supply chains for everything, not just cars.
Yeah, actually, I think that, in some fields it will be harder to find a new way to produce and to have another logistic system. But I think that, yes, cars could affect hardly the economy.
Jean-Jacques Zambrovski?
You know, the world has shrunk in the recent decades. And so, for example, all of a car can be manufactured in Germany or in Italy or in the UK, but a bolt, a screw might be coming from China. And for, you know the story, for want of a nail, etc. And the kingdom was lost, all that for a horseshoe nail. That's a bit of an English poetry. Well, it's exactly the same. For want of a screw, you can be missing how to terminate a car or a piece of factory or an electronic device or even a camera in a TV channel. So we are depending from the others. It's true that the total dependence we have towards China in the recent years might be a problem, which this epidemics or whatever it is revealing. So having some kind of manner to have a supply chain which will not be totally depending on the boats sailing out of China might be worth. But you cannot improvise. It's just making a vaccine. It will take months, if not years, to repatriate, to come back to Europe, some things like antibiotics, the components of which are all made in China or sometimes in India. So it's a real issue. We might dialogue with the Chinese people and see what we can do. Because the European factories, car manufacturers in China had to close and reopen, as your correspondent just said. But the other way around is true as well. Some components in the purely French-made car or Italian cars come from China. And we might, if that would be long, there might be some risk for the economy. It's said that the rate of the economy, the GDP, might decrease by 0.1% in the next year due to this crisis if it ends in the next 2 or 3 months.
We'll see what happens afterwards. Just very briefly, because Jan-Cedric Hansen, we're almost out of time.
Yeah, sorry. Oh, sorry. Okay. Too bad.
No, I was just gonna.
Can I speak?
Just very quickly. Go ahead.
I wanted to say that. The Global Health Security Alliance was created just because the point is that health can impact any aspects of the society, and there is an interdependency between health, economic, politics, and we try to analyze and figure out the nexus of all those components of the society through the health standpoint, because the health standpoint can sometimes, and we are facing that, impact the complete society, and here it's a global society we're talking to.
Mm-hmm. And the converse is true as well. So like the socio-economic economic factors have a huge impact on health, and it's really important to remember that when coming up with these ideas of closing borders, and it's really going to be affecting health and have secondary effects.
Sasrine Singh, I want to thank you so much. I want to thank as well Jean-Jacques Zambrovski, Matteo Ghisalberti, Jan-Cedric Hansen for being with us from Rouen. Stay with us. Media Watch is next. And we say hello to James Creedon.
Hi, Francois. Look at the French media coverage of the ongoing coronavirus epidemic. It's made the front pages again today. Le Parisien, France. It's now France's turn to feel the pressure. And of course, there was that first fatality. And indeed, Emmanuel Macron saying today that really we're looking towards an epidemic. We also saw the carnivals in Nice and other festivities in Menton cancelled, of course, down near the Italian border. A particular concern in the south of France that contamination is more likely. Headlines such as this as well, talking about the coronavirus being China's globalization Chernobyl. In other words, an event almost as big in terms of the impact or the knock-on effect or the domino effect as Chernobyl was for the USSR. Certainly a strong,
of course, we only knew that
strong
3
language.
years later with hindsight that,
right.
that it was going to bring down the Soviet Union.
Exactly. There you go. So that's the sort of language being used in headlines and in editorial pieces. This is in L'Opinion, also in the French press. Here they're being a little bit ironic about what they call the repli sur soi, kind of what would you say, looking inward or regressive thinking, if you like. So they talk about the homo coronavirus. You kind of, it's a reference to a basic man. And they're saying a mammal marked by its inward-looking and tribalist nature. And Remy Godot goes on to write that everywhere nationalists are rubbing their hands with glee. And unless the government wants to add fuel to the fire of far-right anti-immigrant rhetoric, they would have an interest in not allowing their talking points to be contaminated by a catastrophist discourse. Quite colourful language there, but I think that the warning that this could be a gift really to far-right thinking and closing of borders and whatnot. A measured and responsible approach is the best one against the epidemic, says that piece. They're even imagining here what would happen if Emmanuel Macron got infected by the virus. Now, that seems completely crazy, except we know that the Deputy Health Minister of Iran was coughing and spluttering on air because he did get it himself. So it's not a completely impossible scenario. But they sort of, things are getting quite Romanesque, if you like. And this Robin Toutange was looking at the health history of various French presidents in the past and those who were hospitalised and what would happen. And of course, Emmanuel Macron would have to be quarantined like everyone else, but he would be able to probably continue with his job to some extent. Anyway, we saw that he's
not in the age risk category.
No, that was also mentioned. At 42, his health, he'd be likely to be fine. Most of the deaths have been older people, I guess. In any case, we saw that he did speak to hospital staff today at Pitié-Salpêtrière, and of course he did get a lot of criticism because they've been taking kind of industrial action in recent weeks and months. So this was an opportunity to tell them exactly what they think the health system needs to fight pandemics or whatever else. Now, there's a lot more to be said on the way in which the coronavirus is impacting on the political sphere. It's become a political football in the US and elsewhere. Even Democrats are being accused of distorting the readiness of the US for the coronavirus. You're seeing lots of comments such as this. And weeks ago, we were all going to die from World War III because Trump killed Soleimani. But now we're all going to die from the coronavirus. The left is becoming a doomsday cult. So even if there is a degree of disinformation or exaggeration, then it's being taken on board as conspiracy theory fodder, I think you could say. Anyway, there's lots more on that. But criticism as well for Donald Trump's appointment of Mike Pence as the coronavirus czar, given I'll just read it out. Pence doesn't believe in science, fueled the worst AIDS outbreak in Indiana's history while governor, etc., etc. I'll just finish very quickly with the falling sales of Corona beer. This is a real thing.
Oh, really?
Yes, Corona beer. These are...
it's not the antidote.
No, and unfortunately from their marketing point of view, it is going down. Some people saying as well that this Mexican beer from the US perspective that perhaps a border wall needs to be built in order to keep illegal Mexican beer out, stick to real American beer. So a touch of humour, but also, I suppose, referring to the fact that some people would like to see borders go back up in the midst of all this.
All right, we'll discuss the relative virtues of Bud Light and Corona another time. Many thanks, James Creighton. I want to thank our panel once again. So thank you for being with us here in the France 24 debate.